I want to actually do something that is neck lymphatic massage. I want you to take your fingers and I want you to, first of all, take the tips of the first 1, 2, 3 fingers that you have, your strongest fingers here, and I want you to put them in the back of your neck, at the top of the neck, between the skull and your neck. And I want you to kind of dig in there as deep as you can. You might want to just use the tip of your long finger and really poke into those muscles. You're not going to hurt yourself at all here. Start at the midline in the back and just work those fingertips deep into those muscles that hold your head up all day long after you get up out of bed, and work from the back of your neck around to the sides. Just get in there and dig. See if they're feeling tense. You can put your fingers vertical and also go out from the middle of the ridge line of your spine. Oh my goodness. So get in there and roll those muscles around. Breathe into it a little bit. Take a deep breath. Send it into those muscles so that they can elongate, relax. Go back up to the base of the skull. You'll feel the base of the skull and start working around sideways. And as you work around sideways and get to a point behind your ears, you're going to find something that gets in the way. And what that is behind the ear here, there's a downward projection of bone, and that's called the mastoid sinus. And what I want you to do is I want you to work back to front, front to back, massaging in there in a U-shaped path, and get that area loosened up too. Put your strongest finger in there, go front to back, back to front. When you're in the front, you're actually going to be underneath your earlobe, behind the angle of the jaw, in front of this downward projection of bone. And if you get in there, you might even like open and close your jaw a little bit. It'll open up that space. Oh my goodness, it's so tender there. It's practically making me tear up a little bit. That's okay, because the nerves to the face go to all of the sensory organs of the face too. You may even get a little bit of a runny nose from this. That's a really good sign. Just kind of explore there. These are very, very key acupuncture points. So back to front, base of the skull, that U-shaped bone, forward, backward, open and close the jaw, a little side to side. Now take your pincher grip and go diagonal, and go from that U-shaped projection down this big thick strap muscle here that connects that downward projection to your collarbone. Grab that thing and roll it around between your thumb and your forefingers. Oh man, if that's tight, it deserves to be loosened. Switch hands, go to the other side when you're ready. You may want to bob your head a little bit to get some looseness there. Oh, I'm feeling it. When those two muscles are starting to soften, I want you to take your 3 fingers here, and I want you to reach diagonally above your collarbone. And above your collarbone, close to your neck, I want you to roll your shoulder in, roll your shoulder out. Roll your shoulder in, and when you roll your shoulder in, you should feel that area above the collarbone slump down. There's a muscular triangle there, and it's tight when your shoulders are back. When you roll a shoulder forward, it slumps down like a hammock. So feel that slump down and feel it come back taut and slump down. And when it comes back taut, kind of take those fingers. You may take 2 fingers, you may take 3 fingers, and kind of do some small circles. See if that muscular floor between the collarbone, the neck, and these big shoulder muscles back here called the trapezius. See if that hammock has any tight spots in it that need to be worked out. So go in there with your shoulder forward, slowly let it go back, massage it. Then take 2 or 3 fingers, go to the other side, shoulder in and shoulder out. This is some of the most brilliant self-care you can do for yourself, not just for your overall immunity, but for your brain health.
Constant energy through the day. Very interesting. Losing what you don't need, feeling lighter.